Welcome to the American College of Surgeons Bulletin Brief from the front line, Surgeons' Voices. With me today are three of our young surgeons who recently had a publication in our journal of the American College of Surgeons, about the experiences of residents and young surgeons during COVID-19, or at least during the early part of it. So with me today are Dr. Julia Coleman, who is at the University of Colorado, and Roan Glocker, who is at Rochester, and Jad Abdelsattar, who's at the University of West Virginia. Welcome to our program.
Thank you.
Thank you.
Thank you.
Thanks. Let's just go around and, besides the institution, just talk a little bit about your background, particularly your involvement with RAS or YFA. Start with Dr. Coleman, please.
Great. Dr. Wexner, thank you so much for the opportunity to share our work. We had the privilege of starting this work right around March, the beginning of the COVID surge. At that time, I was the chair of the RAS Advocacy and Issues Committee. And so through that committee, helped with Jade in mobilizing, creating the COVID-19 task force. In addition to that position, I've now moved on and I'm serving as the secretary of the RAS Executive Committee, and I'm serving as a RAS liaison to the Committee on Trauma. That last fact being said, no surprise, I'm going into trauma, surgical critical care, and I'll be interviewing later this year.
Fantastic. Well, I wish you every success during that process. Dr. Glocker?
Thanks. Yeah, thanks for having us. I'm a vascular surgeon here at the University of Rochester. Did residency here, fellowship at UAB in Birmingham, and been back on faculty now for going on 7 years. I'm a member of the FACS and then the Young Fellows Association as well, and I'm the Young Fellows liaison to the ACS Legislative Committee, which is how I got tied in with this group here in this project.
Thanks. And Dr. Abdelsattar?
Thank you, Dr. Wexner, again for this opportunity to present our work. I'm an international medical graduate. Started off my journey at Mayo Clinic in Rochester, Minnesota. Did my surgical education research fellowship with Dr. Farley, and then moved on to a categorical general surgery position. I'm a chief general surgery resident now at West Virginia University. I'm interested in breast surgery. I actually just found out that I matched at the University of Southern California in Los Angeles, which will start in June 2021. Super excited to be here.
Congratulations. That's a wonderful accomplishment. So let's move on from your individual personal circumstances to the pandemic of COVID-19. And again, maybe we'll go in the same order for this first question. And Dr. Coleman, what was the impetus for this particular project?
Sure. So like I said, starting in March, it really became apparent that, of course, the COVID-19 pandemic was not just going to have a prodigious effect on our community and our patients, but in particular, healthcare providers. And so there were several informal RAS hangouts that were done in March, where residents started to vocalize a lot of the struggles that they were experiencing, whether that was related to their educational, clinical, or personal experience. And then credit to Jade, he came to me and said, hey, why don't we really explore this and figure out how exactly the pandemic is affecting residents, fellows, and early career surgeons, and in particular, what can we do better to support healthcare providers during this pandemic? And that certainly at that time, not having the foresight for this year was something we were actively hoping could guide things during the first surge, as we've now called it. And I think now this data is even more relevant in the setting of now what we're seeing, again, rising numbers across the country. So the RAS Advocacy and Issues Committee formed a COVID-19 task force, which included RAS and YFA members. And that was the impetus for sending out our survey.
Okay, thanks. Let's move on if we could, and I guess we'll stay in the same order. Dr. Glocker, could you tell us a little bit about the study design itself, like how you set out to answer your question?
Yeah, sure. So we designed a pretty broad study of different types of questions, ranging from, and one thing that I think was interesting about the study is, it went out to all RAS and YFA members, but, the epidemic swept through the country at different times, different rates and things. And so it was important to keep in mind with who we were surveying, where they were and their experience with COVID. And then we asked questions about, both bigger picture, factors such as, has your center had a reduction in operations, elective operations, emergent operations? Have you cared for COVID-19 patients? If you're caring for them, do you feel as though you have, adequate PPE? Do you have adequate resources to take care of them? And then, bigger picture questions about what's going on at your medical center. Have there been financial or salary repercussions? Are they furloughing people? And then on the resident side, questions about, case mix, resident responsibilities, all the, numbers and things that go along with the concerns of being a resident. And then on the Young Fellows Association side, compensation, things questioning about the management of their practice, but then also all the kind of personal well-being and wellness scores of, are you having issues with depression, anxiety, sleep, all those types of things that can lead into, the personal ramifications of something like this.
Okay, thank you. Sounds a very comprehensive study indeed. And I'm sure our listeners and viewers are eager to learn the results. So maybe we can turn to Dr. Abdelsattar and ask, what did you find?
Sure. So we had about 1,160 respondents. 40% of those respondents were residents, and 60% were early career surgeons. In looking at the results broken down into the personal experience, clinical as well as educational, we found 74% of all respondents reported either a negative or an extremely negative impact on their clinic experience. And that was because most of the patients were canceling their appointments. We had 96% of respondents reporting extremely negative impact on elective surgical case volume, which, as one can imagine, resulted in issues with meeting ACGME minimum requirements. The majority reported that the COVID-19 pandemic resulted in a negative effect on meeting their case requirements, but also even the progression of operative autonomy. Even 61% had a negative impact on their didactic curriculum. And surprisingly, 1 in 3, or 30% of our respondents reported that they did not have adequate PPE. And that's certainly concerning given the magnitude of this pandemic.
Absolutely true. Absolutely true. So given the information that you gleaned from this very large sample size, but Dr. Coleman, what are the lessons learned that we're going to bring forward as we're now having surge after surge throughout the country, and not what's called non-essential surgeries being deferred again, staff being out in different places, hospitals being full? What do we do?
Yeah, so that's really the question right now that has enthused us, is how we can translate these findings into actionable items to create an environment that I think is more conducive to improved experience in healthcare providers. We found that the pandemic indeed is very, very significant impact in a negative way on residents and early career surgeons, clinical, educational, and personal experience, and really concerningly high rates of new reports of depression and burnout. And we found that the factors that were predictive of burnout and depression were female gender, lack of access to wellness resources, being asked to provide one's own PPE or having inadequate access to PPE, and a reduction in case volume. And interestingly, we found that what was the one factor that was protective against depression and burnout was adequate access to PPE. And so when we first found these results, we went and presented it to the American College of Surgeons Board of Regents, specifically at that time, the chair of the ACS-RAS Executive Committee, Dr. Naveen Sanji, presented the results on our behalf and started some discussion about how can we better address this question of PPE. And so the RAS Executive Committee is actually meeting tonight to talk about our best ways to do that. And if that's as simple as starting a way where now we can create a reporting system where we can start to collate data nationally of residents reporting where deficiencies and inadequacies in PPE are present, and how we can create a better national system for detection and distribution. And I'm particularly enthused in doing this because I think that trauma and the Committee on Trauma with their trauma systems has done a really good job with sort of doing a pulse check on where we are with resources and how to better approach resource allocation. So that's our hope for the next step, but I think and hope there's a lot to come from this.
It sounds like there will be. One of the issues that we all heard about early on in March and April and into early May was redeployment and re-education. So, you know, Dr. Abdelsattar, you might be interested, or you are interested in breast surgery, currently general surgeon, but somebody may have said, congratulations, you're an intensivist, or we need you in the emergency department. Did your study delve into that area? And if so, what did you find?
We actually did ask if there was any change in the schedule and formatting of the residency program, and we found that across the board there was no one consensus. A lot of, and because of the timing of the survey, I think programs that were hit first had restructured their residency programs, where some of the residents did report that they were pulled into ICU. And they were doing procedures on COVID positive patients. However, while I was here in Morgantown, West Virginia, where we did not have many cases, even though we switched to a 5-day on and off for a month schedule, we still didn't see the surge. And so it didn't really affect my program specifically in the way that it may have affected Dr. Coleman's program.
Yeah, I think there are certainly very large geographic variations in COVID. I mean, we all know that just from reading the lay press, and certainly, you know, Rochester, New York may have been different than Manhattan, but things change around. And at one point in South Florida, we were much worse than main campus in Ohio, and sadly, that for the people in Ohio, that's kind of flipped around as well. And that brings me, Dr. Glocker, are you planning any type of a follow-on study since the situation has changed in these last few months?
Yeah, we've talked about a few different ideas, follow-up study for the second surge, but then also trying to highlight some kind of high-risk groups within the American College of Surgeons and the different groups there, and seeing how they were affected, and kind of some subgroup analyses of different populations within the study.
Okay. Dr. Coleman, any idea how the impact on residency education and young surgeons in practice compares in the US to other countries?
That's a great question. And actually, as Dr. Glocker alluded to, there was actually a fair percent of our respondents that were international and members of RAS and YFA outside of the United States. So much so that I think we'll be able to do some meaningful cohort analyses comparing how their experience is different. It's not something that we've looked into yet, but we have a really rich database. And for those of you that are more interested in what other questions can be asked, we have a whole supplemental section of our manuscript that's got really detailed tables that shows all of the data that we looked at, and there's quite a bit of granularity. So that's certainly something else we're going to be looking at.
Well, I look forward to reading the subsequent article. That sounds great. Does anybody have any parting comments before we close the interview? Any other lessons learned or advice for the future?
I would say in the end, when we look at the results of the study, some themes emerge, and in order to inform future pandemic or disaster responses across surgery programs, we need to think about increasing access to PPE based on the results of our study. We also need to increase access to wellness resources, but at the same time, encourage the utilization, because a lot of the respondents did not know that the American College of Surgeons had wellness resources available. And finally, as Dr. Coleman alluded to, targeting high-risk demographic groups and seeing if there are disparities in the way this pandemic has affected different populations.
Excellent. Any other words, Dr. Glocker?
Yeah, I mean, I think, I found it interesting, some of the responses we got from the young surgeons, particularly that, across the board, more likely they were more worried about spreading the infection to their family, the effects on their practice, and the big picture effects to their patients than they were about getting COVID-19 themselves. So I think it speaks to the work ethic and effort being put forth by the American College of Surgeons, on an individual level towards the effort. So.
Well, we certainly very much value our relation with RAS and the contributions of RAS and YFA, and I've enjoyed over the years, going my 9th year on the Board of Regents, listening to the reports from the YFA and the RAS. Always energetic and always lots of great projects. So looking forward to hearing the next one. Dr. Coleman, you'll have the last word.
Yeah, I just want to highlight that this is certainly, we are privileged to represent the group, but this was really a work of a large group of people. And so the full author list you can see, but the COVID task force included actually 12 residents. And so I'll briefly mention Heather Carmichael, Randy Ryan, Kyung Koo, Purvi Nayar, Michael Vicenio, Cheyenne Sontag, Praneet Chotai, Navin Vigneshwar, Vahan Napoleon, Joanna Ochoa, all were also a part of this project and contributed. And we were also greatly appreciative of the support and co-authorship with Dr. Patricia Turner as well. So many others that were involved and supported us and mentioned in the acknowledgements, but just want to say this was certainly a group effort, and we are privileged to represent everyone that contributed.
Well, thanks so much. I've enjoyed speaking with each of you. I've learned from the interview, and again, I look forward to reading the follow-on paper in JACS. I encourage all of our listeners and viewers who have not yet read your paper that they do so, and I'm sure it'll be food for thought as well as valuable lessons learned to everybody who reads it. So wishing each of you and your families happy and healthy holiday. Good luck in the match. Congratulations on your match, and see you all at the ACS someday in person.